Hello guys, I'm starting a new section on osteology. So in the osteology, I'm starting with humerus right now, and after dealing with each bone, I will talk about the orthopedic aspects related to that bone, so that even orthopedics get completed along with the anatomy of the bones and muscles. So right now, I'm starting with humerus. You know, humerus is really a long bone. I have increased the height of my books a lot to make you see the whole humerus in one go. So this is the humerus, right? So let us start with this. So the humerus has the upper end, shaft, and the lower end, right? The humerus has upper end and then lower end, and the middle part is the shaft. The upper end has a large round head. So this is the large round head. This articulates with the scapula. This is the anterior part of the head. If you see, it has lesser tubercle and the greater tubercle. And posteriorly, if I turn it, the upper end has head and a part of greater tubercle. So anteriorly, you can see the head, which is medially placed. Head is completely medially placed, and sometimes it's not just medially placed, it is medially and a little backwards and upwards, right? It is directed upwards. If you see, it is upwards and backwards, and it is medially placed, right? If you see the upper end, there is a tubercle which is called as lesser tubercle. So this is the lesser tubercle which is facing anteriorly. This is lesser tubercle. And this is the greater tubercle. There is a groove between the two tubercles. This is the groove which is called as bicipital groove or intertubercular sulcus. The lesser tubercle lies in the anterior aspect and medial to the intertubercular sulcus, and the greater tubercle lies in the lateral aspect, and it is lateral to the bicipital groove. The lesser tubercle, if you see, it has the upper smooth part. See, this is the smooth part. Upper smooth part and lower a little rougher part is seen. Whereas if you see the greater tubercle, this is the greater tubercle which is completely present laterally, and this greater tubercle has attachment of three muscles, and they are seen as three depressions: superior depression, inferior depression, and the middle depression. Superior depression, inferior depression, and middle depression. In the lesser tubercle, there is upper smooth surface and lower rough surface. This is the upper end of the humerus, containing the head of the humerus, greater tubercle, lesser tubercle, and intertubercular sulcus. And this is the shaft of the humerus, right? This shaft of the humerus has three borders, which is anterior border. This is the medial border, if you see, medial border. And this is the lateral border. So anteriorly, if you see, this is the medial border. Sorry, this is the anterior border. This is the medial border. This is the lateral border. Anterior border, medial border, and lateral border. Anterior border, if you touch it and if you increase it, if you go along the anterior border, it becomes the lateral border of intertubercular sulcus, and it continues with the greater trochanter. So that is the position of anterior border. Anterior border, it runs anteriorly, and then it goes lateral to the intertubercular sulcus and continues with the greater tubercle. Okay, and now if you see the medial border, if this medial border, it is not distinct. See, in the upper end, it is smooth, but here you can see the demarcation. See, upper end, it is indistinct, but medial border in the lower end, it is clear, and if you trace it downwards, and this is traced downwards and it goes around the lower part, and if you trace it upwards a little, if you trace upwards, it is a little traced. I think you can see, right? If this medial border is traced upwards and upwards, it is traced up to the medial border of intertubercular sulcus or bicipital groove. So this is the medial border. Okay, and if you see now the lateral border is completely indistinct. Only the lower part is completely indistinct. Only the lower part of the lateral border is distinct and it is seen clearly, right? If you see, even you can see it clearly. This is the lower part of lateral border which is clear. Okay, now these three borders, that is anterior border, medial border and lateral border, divide the shaft into three surfaces, which are, this is anteromedial surface, which is between anterior border and medial border. The surface between anterior border and lateral border is anterolateral surface, and the surface between medial and the lateral borders are, the surface between medial and lateral border is posterior surface. So if you see, this is the anatomical position. So this is anterolateral, this is anteromedial and the posterior one. So there are three surfaces: anterolateral, anteromedial and posterior. If you see this anteromedial surface, it becomes continuous with the intertubercular sulcus. The anteromedial surface becomes continuous with the intertubercular surface, intertubercular groove, right? Now we have to note certain features which are present in the shaft. Among them, this is the anterolateral surface. In the anterolateral surface, there is a V-shaped rougher area which is called as deltoid tuberosity, which is present near the middle of the surface. If this is the whole surface, near the middle there is a V-shaped tuberosity which is called as deltoid tuberosity, which is present on the anterolateral surface of the bone. Okay, this is deltoid tuberosity. If you see the anterior limb of this tuberosity, anterior part of this tuberosity is around the anterior border of the shaft, right? The anterior limb of this tuberosity is around the anterior border of the shaft, whereas the posterior limb lies just above the deltoid groove. So this is the deltoid groove here. This is like this. This is the deltoid groove. When you observe this shaft from behind, this is front. Observe it from behind. If you observe it behind, the upper part of this tuberosity is crossed by a deltoid groove. So this is the deltoid groove, okay, which runs downwards and laterally, right, like this. So this is the deltoid groove. In this bone, deltoid groove is not prominent. Please note that. Okay, if you see the lower end of the humerus, this lower end has an irregular shape. It has completely irregular shape. And so the lower end of the humerus is called as condyle. As it has irregular shape, it is called as condyle. So the lowest part has medial and lateral parts. See, medial prominence and also the lateral prominence. This is the medial prominence, this is the lateral prominence. Medial prominence is called as medial epicondyle. This total is condyle. So this part is medial epicondyle. This is lateral epicondyle. If you see the medial border of the shaft of humerus continuous with medial supracondylar ridge. This is medial supracondylar ridge. This is called as condyle. So this border is above the condyle. So it is supracondylar and it is a little sharper. So ridge. Medial supracondylar ridge. Similarly, laterally, the lateral border continues has lateral supracondylar ridge. The two ends have prominences, as I have said, medial epicondyle and lateral epicondyle. If you see among the medial and lateral epicondyle, medial epicondyle is the strongest, largest. So if you see between these two epicondyles, the lower end has irregular surface, this one. This is the articular surface. Okay, if you see, one is a little hollow, this one, and the other is a little rounded. So this rounded part, if you see, this is called as capitulum. This articulates with the head of the radius. This is called as capitulum, and this articulates with the head of the radius. And this is called as, this which looks like a pulley, it is called as trochlea. This is trochlea, this is capitulum. This is trochlea, this is capitulum. Trochlea articulates with the upper end of ulna, which is trochlear notch. Above these, there are two depressions if you see. One above the trochlea and the other above the capitulum. The depression above the trochlea, it is radial fossa because it is articulating the head of radius, whereas the depression above the trochlea, it is coronoid fossa. Coronoid fossa. Okay, if you turn it posteriorly, there is a depression posteriorly which is called as olecranon fossa. So these are the complete structure of humerus, and there will be a hole for the nutrient artery. Let me locate it. If you see here, on the anteromedial surface, this is the hole for the, that is the this one. Yeah. This one. This is the orifice through which the artery, which artery? The nutrient artery of humerus passes. So now let us learn about the attachment of muscles which are there for the humerus. So guys, before going to the attachment of muscles, let me show you the articular surfaces of how it articulates. So if you see, this is the ball, this articulates into the glenoid cavity of the scapula. Right? Posteriorly, if you wanted to see. Right? If you have bones, try to articulate it. You will learn a lot through bones rather than through just pictures. Right? So this is how it articulates at the upper end. Now coming to the lower end. So first I'll show you how radius articulates. Like this. This is the fossa. Here, like this. Yeah, this is the, see, this is the round capitulum which fits into this hole. this depression, sorry, not hole, this depression. So it is something like this. So that is the reason, see, it can't go beyond this. That is the reason the elbow movement is really fixed. We can't extend it a lot. Okay. Radial fossa, capitulum, radius bone. This is the radius bone. I'll deal it in next class. Then ulna. See. Ulna articulates at the capitulum. So if you see back, see this olecranon fossa, it is for this olecranon part. So it will be something like this, right? I'm not able to move both of them. Yeah, but it will be something like that, right? So now let us learn about the attachment of this humerus and other muscles. So this one I will prefer always in this way. Oh. So this attachment of muscles, I'll do it in next class, because truly speaking, my charging of my tablet is being lost, is very less. So I'll do it in my next class. Thank you guys for watching my video, and I hope this video you will like it, and I'll continue making it on all the bones which are there in our body, and I'll also deal orthopedics part along with it. Thank you for watching my videos. If you have any suggestions, please comment it in the comment section below. Thank you.